Colette, thank you so much for both being here with me today to talk about not only our allied health programs here at CCC, but also the medical assisting program, which is a new program for us that we'll be getting into in just a little bit. But I'm going to start with you, Shellie, first of all. Tell folks, what types of programs are we talking about when we talk about allied health programs?
Basically, we're just talking about careers, you know, in the medical field.
Okay. And what type of programs like that do we offer here at CCC?
We offer associate degree nursing, practical nursing, radiography, surgical technology. We offer medical assisting, phlebotomy, and we also offer EMT bridge.
Oh, wow. Okay, we have quite a few then, don't we?
Yeah, sure do.
All right. And I know that the requirements, of course, for each one are very specific. But just kind of in an overview, can you tell me if someone's interested in getting into allied health programs, what types of requirements are they going to have to look at?
Okay, first off, what they're going to do is they're going to come into student service. If they're a new student and they do an application, they'll just list Allied Health as a program.
Okay.
And if they already have a program, they can come in and do a program of study and declare Allied Health. And then from that point, they'll go to an Allied Health meeting. And when they come to Allied Health, that's when they'll declare which program they want. And then basically in the meeting, we go over everything that I would want to know. We go over all the different programs and what's required. After that, they're working on their prerequisites and their related courses, and they're studying for what we call the PSB, which is Psychological Service Bureau test.
One of our new allied health programs for the fall is going to be medical assisting. Colette, tell me a little bit about what is a medical assistant?
Okay. Margo, a medical assistant is the healthcare professional that you will see in physician offices, health departments, ambulatory healthcare settings that are versified where they can do administrative and clinical duties. Mainly they're doing the clinical duties, assisting the physicians with exams, venipuncture, and those type of things, supervision of administering medications, but they can also be the person that you will see at check-in, check-out, making your appointments.
Okay. What type of qualities does someone have to have? It seems like that a medical assistant is going to be required to wear many hats.
Very, very. They will be. They are multitaskers. So I think a very good, strong suit for them would be organizational skills, very structured. So that is a strength that I think is very important for medical assistants because they are asked to wear many different hats.
And what types of classes are they going to have to take in the program once they actually get into the program?
The programs specialize around administrative and clinical procedures and competencies, venipuncture, and laboratory procedures. So, and all of those classes are set around for that they will eventually be able to sit for a certification exam after they complete the entire program.
Okay, and I know that this program is a little bit different. I know Shellie mentioned the ADN and the LPN programs that we offer, and in those types of nursing programs where you have clinicals, where they actually go out on site and work on site through clinicals. But for the medical assistant, what is their equivalent to a clinical?
Their equivalent to a clinical is a practicum, and it's most times it's called an externship, where they'll actually be able to go in a physician's office or one of those healthcare settings that I mentioned previously and do usually about a 4-week rotation at one specific place and then another 4-week rotation. So usually around 8 weeks, a rotation of working in that facility free of charge, so it's just externship. So they actually get hands-on training as far as assisting physicians, actually being able to go in and do a few of the laboratory procedures that are regulated by the actual state and things like that.
Okay, and I'm sure that we have lots of support too in Cleveland County that work with the college.
Yes, we do. Yes, we do. Many physicians' offices that will be willing to have them come in and train there.
Okay. And Shellie, I know we were talking before we started the segment, and you had, I think you said 80-something people take the PSB yesterday, and and so and of course the medical assisting program is going to start in the fall. And how many folks do we already have that are interested in this program? Do you guys know that number right offhand?
I've been looking through the folders and reviewing those, and right now there's probably about 50 to 60.
Okay. All right, so we've got quite a few that are looking for those spots. And this is something, too, I think is really interesting for folks, because it seems like everybody that comes in, everybody wants to go into nursing. But a lot of times, do you find kind of as you work with these students, Shellie, do you find that maybe once they get into it, that they find that maybe nursing might, once they learn about our surgical technology and our radiography and phlebotomy and all of our other programs, that there are other things that they might be interested in?
Yeah, because the different programs have different personalities. Some are people-oriented, and others may be like pinpoint where the problem is or fix the problem.
Okay. And what do you think, Colette, for someone, what would be the advice that you would give for someone who is going into medical assisting or looking into this program?
Okay. The advice that I would give them is to really dig deep down and just, if you are a person that really loves to be the person to talk to people, to help people, and things like that. If that's something that you have a passion for, I think that is something that they need to look into. And it's all about, I believe, if you desire to help people and have a willingness, I think that is something that they really need to study and think upon.
Now, Shellie, I know that we do require the students to come to the Allied Health informational meeting, all of them. So tell me, does everyone have to come to that meeting?
Yes, everybody except for the EMT bridge that I talked about, everybody else has to come to, it's mandatory that they come to the meeting.
Okay. All right. And go ahead and give us your information again for anybody who's watching that just, is very interested in everything that we've talked about today and wants to talk to you a little bit more about Allied Health programs here.
Okay. The phone number is 704-669-4073. My email address is Hamrick, SN, that's HAMRICKSN, at clevelandcc.edu.
Okay. And Colette, I know that you wouldn't mind either having folks call you to talk to you a little bit about the medical assisting program, so give us your contact information.
Okay. The phone number is 704-669-4135. And my email address is hill, HILLB, at clevelandcc.edu.
All right, perfect. Ladies, thank you so much for talking to me about this. And I know that we always have so many folks who are interested in the Allied Health programs, and so this is information that we just can never reiterate and get out there enough. And Colette, I can't wait to have you back, maybe this time next year, to talk about the program and see how it's done almost through the first year. So we'll see you back then, okay?
Thank you so much.